The school-age child. The first day of school is going to be a major milestone in this age group. They have dramatic changes that have occurred in their thinking process, their social skills, activities, attitudes, and the use of their language. Every aspect in their life is now going to be subject to comparison to something else. Most will reach this age with the necessary skills, abilities, and independence to function successfully. They do show an increasing interest in group activities, making things using their motor, cognitive, and social skills. Success is going to provide a lot of self-confidence and feeling of competence. Erikson views this time period as industry versus inferiority. If the child is unsuccessful in completing activities, they develop a feeling of inferiority. Health concerns now become a concern of the community. The state sets requirements for different examinations and immunizations. In this age group, there are a few diseases that will have an onset. Accidents remain the most serious hazard at this point. When we are collecting data, we have to interview the child and make sure that you include the child in the interview using age-appropriate questions and be honest when you're answering the child's questions. Use stories and handbooks as appropriate. Listen attentively to the child's comments and make them feel important. Then when we begin to collect the objective data, remember that's information that's observed directly. This is going to include their height, their weight, all those vital signs, and an examination of the body systems. It is usually not going to proceed in a head-to-toe manner as it would in an adult, and it's really important that we consider the child's age and development. Aspects that might be more traumatic and uncomfortable, we save for the latter part of the examination. This process might be familiar from previous visits, and it does allow the family caregiver to be present. Respect the child's privacy and keep them covered until a specific part of the body is examined. Then we take all of those observations, record them, carefully describe them in any detail, and document everything. Make sure that you focus your assessment on the specified complaint. Use the information to then plan the child's care. When we're taking vital signs, a few things that we need to remember with this age group is count their respirations during a quiet time and observe for any retractions that could indicate respiratory issues. Because the child is older than 3, blood pressure should be routine, and we need to explain that procedure. Make sure you use the right size cuff and allow the child time to rest in a quiet environment before you get that reading. If you get an abnormal reading, check it twice, at least 1 to 2 minutes apart. Their heart rate should be a radial pulse on these children. If it is unusual in quality, rate, or rhythm, make sure that you count that full apical heart rate for a full minute. Cardiac monitors, if those are used, just like with adults, they're there to detect changes in the cardiac function. If it alarms, make sure you check it immediately. This just shows the ranges for pulse rates for the different age groups. And this shows the different blood pressures. Rules of medication administration in children. Never give these kids a choice of whether or not they're going to get the medication. And that is remembering, though, that we do need to give the child a choice that allows them some control. Do you want to hold this medicine cup or do you want me to hold this? Except, is an example. We never lie to them. Make sure that you keep those explanations very simple and brief and in words that the child is going to understand. If the child is fearful, let them know that it's okay. It's okay to be afraid and it's okay to cry. Don't talk in front of the child as if they're not there. Include them in the conversation. Be positive in approaching the child. Be firm and assertive. And keep the time between the explanation and execution to a minimum. All preparation should be done out of the child's sight. Bring it into the room or turn around once everything is prepared. Make sure that you obtain the family's cooperation. As with any pediatric dosage calculation, we have to have our computations checked by another qualified person that is able to give medications. Errors are really easy to make and very easy to overlook. So really important that we are doing everything we can to prevent this. Medications are going to come in liquids, powders, capsules, tablets, and the age of the child and their ability to swallow pills is going to determine the type of medication they get. Make sure you use the appropriate calibrated device or medication cup to administer liquid oral medications. The child's physical growth at this point in life is going to be slow and steady. With their weight, they are going to have an annual weight gain of about 5 to 6 pounds. By age 7, they should be about 7 times their birth weight. They have an annual increase in their height of about 2.5 inches. Pre-adolescent growth, there's a spurt that happens, and in girls, it's usually about 10. In boys, it's closer to the age of 12, where they seem to do a lot of growing very quickly. As far as dentition, they start to lose their deciduous teeth about age 5 or 6 on average. Those 6-year molars are going to start appearing. They're really key into helping that jaw get its appropriate shape, and it affects the alignment of the permanent teeth. As the child is around 6 years old, the skeletal growth is flatter, but they tend to have that protruding abdomen and the lordosis, in other words, that curvature to the lower back. At around 10 years old, that spine begins to straighten, abdomen gets flatter, the body is generally more slender and long-legged at this point. The bone growth is mostly in the long bones. Maturation occurs more rapidly in girls than boys, and more rapidly in the African American ethnicity than in the white ethnicity. If you look at table 26.1 in your textbook, you will have a little more detail to information. So, true or false? Erikson's developmental task for this age group, just a minute, is industry versus inferiority. This is true. The school-age child is interested in engaging in meaningful projects and seeing them through to completion. This will result in the refinement of motor, cognitive, and social skills and development of positive sense of self. Excessive or unrealistic goals will defeat the child and possibly lead to feeling inferior rather than self-confident. With positive support, the child will develop coping mechanisms, a sense of right and wrong, a feeling of self-esteem, and an ability to care for themselves. Cognitive skills are going to begin developing at about 7 years of age. They enter the operational stage per Piaget. They develop the cognitive skills that help understand conservation of numbers, mass, weight, and volume. Each child will be a product of personal heredity, environment, cognitive ability, and their overall physical health. However, every child needs love and acceptance with understanding, support, and concern when mistakes are made. In your textbook, uh, it gives you a place to look for tips to reinforce family teaching. Around 6 to 7 years old, these children are still engaging in magical thinking, and they may have trouble distinguishing fantasy from reality. If they attend daycare, preschool, or Head Start, it will help make the transition into first grade better. Those that don't have this might need to take visits to the school to see what's going on, maybe even a trial basis. Group activities are really important in helping kids move through this developmental stage. They do begin to enjoy participating in real life activities such as learning to bake cookies or learning how to plant a garden. They love making things. Between 7 and 10 years of age, things begin to change. Between 7 and 8, they begin to shake off that acceptance of parental standards and become more interested in what their peers think. Their interest in group play increases and becomes very important. Individual friendships begin to form, and it's also the beginning of many recreational sports, team sports. It's also a time of decentration where they see several aspects of a problem at the same time and to understand the relation of various parts to the whole. Magical thinking is now going to be replaced with cause and effect relations. Then still during the 7th or 8th year, they do have an increased understanding of conservation of continuous quantity. They also develop reversibility, or the ability to think in either direction. In other words, they can count forward 1 through 10. They can count backward 10 to 1. We also see classification where they're able to put group objects into a hierarchical arrangement. And they also love to collect certain items. So another question. A school-age child aged 7 to 10 years moves from pre-operational egocentric thinking to what? And this is B, concrete, operational, decentered thought. Increased activity of this age group is going to require more food to supply the necessary energy to keep these kids going. They do need appropriate servings from all 4 food groups, and we tend to look at the choosemyplate.gov. They'll need 1,600 to 2,200 calorie diet with portions of fruits, vegetables, grains, and proteins and dairy. These kids can learn to eat most foods. Their tastes are going to develop. We need to allow the child to express food dislikes and allow them to refuse if they want. They'll learn by examples set by others. They tend to prefer those simple, plain foods. Snacking habits, however, should be carefully supervised. And at this point, obesity is a concern. Obesity can be from a genetic tendency, the environment they live in, a sedentary lifestyle, a poor diet, or the adage, clean your plate, or fast foods. We need to encourage physical activity, limit their dietary fat, their bullying, nagging, and feelings of inferiority. Um, if those things happen because they're overweight, can just increase that obesity. Health teaching should reinforce the importance of proper diet. Family and cultural food patterns are also going to have an effect. And we need to consider the school lunch program versus home-packed lunches. These children should be old enough to be partially responsible for preparing their own lunches if they decide to take their own. Routine health care and education, we need to be looking at their health habits, their safety, even talking about sex education and substance abuse education in this population. These children should have yearly physical exams by their healthcare provider, twice a year dental visits for cleaning and application of fluoride. The immunizations they need will be the tetanus, diphtheria, pertussis, or TDP, sometimes called the Tdap. The human papillomavirus vaccine should also be given as early as age 9. Scoliosis examination should be completed, and vision and hearing screenings, either annually or biannually. And a lot of times this is done by the school nurse. Kids this age are usually healthy. Family teaching, they still need reinforcement of healthy habits by family caregivers, including proper dental hygiene, that well-balanced diet, exercise, extracurricular activities, and sufficient sleep. The 6-year-old needs about 12 hours of sleep. The school-aged, about 10 to 12 hours of sleep. Health education will include basic hygiene, sexual functioning, substance abuse, and accident prevention. Schools should include these topics in their curriculum. And many schools do integrate health and sex education into the curriculum, and it's taught either by a classroom teacher or a health educator. There's also community programs that might be available for children to teach them these things. Nurses can become active in the community and help make these kinds of programs available for these kids. Now, a lot of people think that sex education is just about adult sexuality and reproduction, but it also needs to include helping the child develop positive attitudes towards their own body, their own gender, and their own sexual role. It might just be limited to one class in the 5th grade, and information about menstruation would be provided to the girls. Separate classes would be provided for the boys and girls. Many children don't have a home where this information can be taught, so they need healthy, positive information so they develop those healthy attitudes about their own sexuality. Printed material is available for family caregivers that might feel uncomfortable talking about these things. Exposure to information through the media can lead to misconceptions and misunderstandings concerning their sexuality. So schools are working to integrate appropriate information in a sensitive, age-appropriate manner. Now, the substance abuse education, the Just Say No programs, they need something to teach them about harmful substances. These kids might try cigarette smoking chewing tobacco, using those electronic cigarettes, alcohol, and other substances. They can do that at a pretty young age. Inhalants would be substances that have volatile vapors that can be abused, ex- especially the deliriants, which contain chemicals that give off fumes and produce symptoms of confusion, disorientation, excitement, and hallucinations. They're most commonly found at home, which is kind of scary, including model glue, rubber cement, cleaning fluids, kerosene and gasoline vapors, butane lighter fluid, paint thinner, varnish, shellac, hairspray, nail polish remover, shoe polish, computer keyboard cleaners, propellant in whipped cream spray cans, aerosol spray paint, upholstery and fabric protection spray cans. Family caregivers need to learn the facts about drugs and alcohol and the different harmful substances that might be in their home. The U.S. Department of Education does provide references. So, question. The best way to teach a school-aged child about proper eating is for the family caregiver to set the example and eat a proper diet themselves. True or false? This is true. Next question. Showing the child the various equipment and materials which might be used for a medical procedure is going to help the child better understand and accept what is happening. True or false? This is also true. And now for your post test.